everyone. It is April 3rd, the third day in HIE Awareness Month. I'm Betsy Pilon, Executive Director of Hope for HIE. I'm thrilled to see so much hope in action already from our community, from our partners, from our families. And today we're really excited to bring to you a Q&A introducing, for those that don't know her, Allison Moise to our community. Allison has been a part of our community for several years as an HIE parent, and she has been a volunteer. She is like a superstar. And then she has had increasing roles over the past couple of years. 2 years ago, I believe, we started, you were the clinical research or clinical trials peer support lead, starting in that role. And then your role has grown out to be the peer support coordinator within Hope for HIE. So Allison, welcome.
For having me.
And if you guys are joining us across social media, please let us know where you're joining from in the comments. It's always fun to hear because I know that a lot of people are always engaged and excited. So Allison, I'd love you to share with everyone and introduce yourself on your journey with HIE.
So as Betsy said, I'm Allison Moise. I am an HIE parent for now almost exactly 8 years. His birthday's tomorrow. My son Rob was born with a hypoxic injury. We live just north of Boston, Massachusetts. I found Hope for HIE in the early days in the NICU. I had sent my cousin what was going on in the hospital, and she had started Googling and found Hope for HIE and sent it to me. So I joined right away, kind of like most people in our community, and I've been a part ever since. I started with my first mom retreat in 2018 in Colorado. I've been to 2 different parent retreats, and then I volunteered to be a part of the planning committee for our last mom retreat in 2023. And that's kind of how I first started volunteering. And then when the peer mentorship program came around, I volunteered to be a peer mentor. And then, as Betsy said, it kind of has evolved. And I started with the clinical trial peer lead, and then now the peer mentorship coordinator.
So many things, never a shortage.
Yeah, exactly.
Wonderful. So, let's talk a little bit about your journey and what, you've gone through a little bit with Rob, and what has kind of inspired you to, to get more involved and to get in particular involved with peer support, and a part of your background, I know includes social work. So can we talk a little bit about that?
Yeah, so I think what really got me started with the peer support and really kind of got me hooked in knowing like that this is so important to have people that just get it. When I went to the first mom retreat in 2018, just being surrounded by people that I didn't have to explain our story to. And even when I did, they were like, yeah, absolutely. Like, I totally get it. Like, I've been there, I've done that. Was really just, I feel like, monumental to my parenting journey. That was like, okay, I'm really not alone. Because even in the Facebook group, like talking with people, you're like, okay, people get it. But then having that connection with people was just so big. And I just know how I left that feeling like a fresh of breath air and just being like, okay, I really am not alone. And it just kind of spiraled from there. It's, and then once the peer support program, I was like, okay, this is what I want to do. I want to help people not feel alone. And when Rob was born, I had to leave the social work field. I used to work at a group home for teenagers that were in DCF custody or state custody. And then I used to also work at a school for kids with autism and significant behavioral issues. After he was born, I decided I wasn't going back into the field because he needed me full time. And this kind of gave me that opportunity to give back, feel that connection, get back into the helping field in one way or another. And it just really allowed me to kind of almost fill my cup, be that person for people that they were for me in the beginning.
So let's get into the different parts of the roles that you've been growing into in the organization. And what do you believe makes peer support so valuable for families affected by HIE? And can you talk a little bit about, kind of an overview of the programs that we have as well?
Yeah. So, like I said, I started as a peer support mentor back 3 years ago when we started with the program, in the very first cohort. And kind of growing from there. So I can kind of go into the overview as a whole. So we have our peer support one-on-one mentorships. And then we have our peer mentors on call. So a one-to-one mentorship is you're paired up with that one person for up to a year. Can be shorter, and it's just up to that year point. And you really get that one-to-one support. You have an email or a phone number, whatever the best mode of communication is for you. You can FaceTime. We have all different forms. But it's having that person to touch base with, to be like, hey, we had a really crappy appointment today. I need to talk to somebody. Or, hey, did you go through this? Or have you ever heard of this? Or just kind of being that sounding wall for someone. The mentorship on call is a one-time phone call, typically around 30 minutes, or a FaceTime. And it just gives you that person who has that lived experience to ask those questions you have in the moment. And it's not that long-term connection, but it's definitely good for those, like, especially big turning points, big questions after like a big appointment, or just kind of just needing that sounding wall in the moment. Well, you're just like, I need to talk to someone that gets it within the next couple days. So that's really the breakdown. We also have like, dad mentors. We have extended family mentors. So we have a little bit of everything for everybody. But, we can't guarantee that someone's going to have your exact experience or be able to connect you with someone like exactly in your area. But we try our best to connect people with, similar type situations. But in the beginning, we're all in that same wait and see period. So really anyone you get connected with is really going to know what you're going through, especially in those early days.
Yeah. And I think that's such an important point to make, because I think, we've done a lot of research and meetings and things diving into other peer support programs in, kind of the NICU space, in, the medical complexity space. And, I think everyone kind of has the same thing, and making sure that we're communicating the scope of the program well, and that it really is empathetic support and psychosocial support. It's not meant to be kind of like a medical conversation as much, because that's a little bit outside of the scope, but certainly getting fellow family perspectives of going through things, and just a lot of validating and a lot of just being there and knowing that you're not alone. So less on the very prescriptive
Yeah.
and I think sometimes like people are looking for, I know in particular, as you kind of travel through this journey, looking for your child's twin, right? Who is a couple years ahead of you, that that had a similar injury pattern and outcome and things like that. And sometimes that's really tricky to realize that like our kids are individuals. So, and there's no two kid that's going to be super similar and exact in that journey. And making sure that people know that we're here, and our mentorship program is here to be supportive.
Absolutely. And all of our mentors, they're active in the Facebook groups. They support in our Zoom support groups monthly. So we're really just kind of those people that are there to be that sounding wall, like that friend you need in the moment,
For sure. I mean, it's been so great to see this accelerate. And I know that like we are trying different things like office hours and, like having the mentors a part of the support groups and, and all sorts of things. And so it's really been a really, great growth period for this. And so with your role, I know you're working with Jen, our social worker, and you guys are, doing matches and connections and checking in with the mentors and the mentees and kind of overseeing and making sure things are, going well.
Absolutely. It's a lot of, my position in particular is a lot of like the administrative part of the peer mentorship program. So I receive the applications, I go through, like trying to figure out, if it's a dad mentee applying, trying to match them up with a dad, or, someone who is, maybe we have someone who's particular in, I don't know, like the grandparents or, a twin birth. We do have some of those that are more specific, but just really finding someone that has the time available to be able to be that sounding board for you. So I, figure that out. Then I'll send emails out with the introduction. So when you apply, I send an email saying, we got your application. Here are some of our resources while I get you matched, and then reach out to the mentors. And then I'll send an introductory email, and then you guys take it amongst yourselves to figure out the best way of communication for your relationship.
That's really helpful to let people know how the process works, for sure. So, and then in your other role, working and moving into research, tell us about getting started as the clinical trial peer support lead.
Yeah. So as you said earlier, I started this about 2 years ago. So Hope for HIE has our Halo of Support model, which includes me as the clinical peer mentor. So if you are work with any of the research trials that we are partnered with, and you opt into the peer support mentorship, you get me as a peer mentor. I have enrolled my child in multiple research studies, so I understand how scary that can be and kind of the ins and outs and the unknowns of research studies that, you kind of just like, oh yeah, I'll sign my kid up for something. I have no idea what's happening or what phase 1 or phase 2 means or how's the follow-up going to be. So it's really just nice to have that person that's been through them and to be like, hey, yeah, this is normal, or maybe you want to check in with the research site if you haven't heard from them, or, being able to get them connected to resources if they can't get to the research trials for some reason, working with Jen to, talk with the research companies and see if, maybe there's stipends to get people gas cards, or, maybe they can switch it to a virtual appointment if you can't get there, or just kind of trying to be that sounding board and that middleman also, just to help the research companies, but also really help our families get their needs met. And, they have volunteered their time to be a part of this. We don't want it to make, their lives, it's not, research studies aren't supposed to make your life more complicated. You're dedicating your time and energy to science and to better the lives of families, even down the road. So trying to make that as seamless as possible and really just be that person that has been there, done that. It's really, I remembered we signed Rob up for his very first research study at like 4 hours old in the NICU. And my husband called me and was like, they want to sign him up for this. And I was like, okay, I guess so. But it's really, we have always taken that standpoint of, even if it doesn't help him, it might help families down the road. And that's really kind of my driving force behind being a part of the research advocacy space is, just, it might not help us in the moment, but changing the big picture for the future of HIE families.
For sure. Yeah. And so, for those that are tuning into this, we partner with many different types of researchers. There's a ton of energy right now, in particular with neonatal HIE, but there are things going on for HIE outside of the neonatal period. And also there's a work group that we're pulling together in conjunction with some academic researchers about pediatric acquired HIE and setting a research agenda for that. And so this is something that, we're constantly behind the scenes, and it's hard to talk about a lot of times because as you're in a lot of these meetings, like, it's just not newsworthy yet with a lot of the work that goes on behind, but it takes a long time to get sometimes to that public standpoint. And so we do partner with academic researchers and with industry partners. And so, there's a lot of different there's a lot to learn about it. And so we've created a clinical trial research hub. We have made sure that these partnerships, when we're partnering, doesn't matter what kind of partner it is, that we're looking at how we can best serve families together. And so your role has been such an important part of that in what we call this halo of support model, because we know our families have a real strong legacy of participating in research. It's why we have cooling. Families had to opt into that and say, yes, please chill down my baby for 72 hours. Like, what? It sounds like science fiction, but we have amazing community members that have shared their experiences enrolling in those early trials and then enrolling in all these moving forward. They've also shared what doesn't go well or why they've opted out or the challenges that they've faced. And so being so generous with that information, we're able to take that as an advocacy strategy for the unmet needs of our community and build this framework that includes having someone to go to at Hope for HIE, having support and in and out of clinical trials for social work, child life, peer support. But this is really the next frontier where we've built this support framework. We have human beings now, trained mentors, credentialed staff to do this work and do it in a high level for our families. And in a way that hopefully helps as many people as we can and as many, ways as we can to connect and to feel a part of a community and to be an active part of the community. This month's theme is hope in action. And so, this is hopefully a call to action as well. Anyone that's tuning in can learn more about how to get involved, or, if you need support, where to tap into it. And if you want to be a supporter, you're feeling like you're at a good part in your journey. There's lots of ways to get involved in different aspects of the organization and the network of support that we offer. So I just wanted to share a little bit about that. And that really, kind of tees up a little bit of our next topic with what you've been getting involved with, which is advocacy. And so many of these things just cross over, right?
Oh, yeah, absolutely.
And so, we, again, kind of the evolution of the organization too, where we, started as like one Facebook group and then we knew like we needed education and support for HIE and really spent a lot of energy for the first several years on that. And then now we're at this point where we're exploding with research partnerships, which is exciting. We all need more for our kids. We know that, and for, unfortunately, those to come that will join us today, tomorrow, next week. And then advocacy is such a huge part of this. And so for you, Allison, I know you've been getting more involved in the advocacy side as well and representing us at conferences. And I want you to talk about the opportunity that you just traveled and came back from with the Epilepsy Foundation, because you were selected out of hundreds and hundreds of applicants. 30 people were selected. You're one of 30 from different advocacy organizations to attend and participate in a research ambassador training, advocacy training with the Epilepsy Foundation in Washington, D.C. So I'd love to hear more about this program that you went through, the process that you went through, and kind of the what you learned and what those key takeaways are.
Yeah, so it was a whirlwind of a weekend. I went to DC a couple weekends ago, and it was super fast turnaround. Flew in Saturday, flew out Sunday. It was a lot to learn in a short amount of time, but it was such an amazing experience. The Epilepsy Foundation did an amazing job putting on this boot camp, and it was the first ever. And like you said, it was one of 30 people that got to go. It was just really incredible to be in a room full of people that really had the same ideas and same mindsets and really wanted to just push forward for the best of everybody. And it was really just, obviously a lot of them there and was specifically in the epilepsy fields, but it can be crossed over into almost everything, especially the HIE world. So we learned a lot about the process that pharmaceutical companies have to go through to bring medications or wearable devices or anything like that to market. So from the very beginning stages of the ideas and getting funding and the FDA process and all the way through to market, and really how patient advocacy can play a role in every single step along the way, from the beginning stages all the way through to publication, in how, patient voices and the lived experience are so critical to these companies, because they can think all they want, we have this medication or this device and we think this is going to be great. And then it gets into action and then we're like, that's not feasible, or this doesn't work, or this side effect's too much, or, it's really having people who have been through the process, have experienced it, and just what the needs are of the community. They could think, oh, they want this great device, and the community they're like, no, we already have something like that. We don't need something else, or that doesn't make any sense. It's really just being able to voice our lived experience and our opinions around it, but in a professional manner and in a way that it's going to make a difference along the way. And we even learned how the FDA takes patient advocacy and patient experiences into trials, what meetings they have that you can voice your opinions, or sometimes they don't allow, patient advocates at the actual meetings, but they'll collect letters to be able to pass along. And there was a gentleman that used to work at the FDA that, gave his spiel from, when he used to work there and how things worked, and just how, meaningful those letters were, and how they really did take the time to sit down and look at them and listen to the people who are there every day and living day-to-day lives. And it was really great. We had people from all over the country there. There was great representation from either parents or, people that have epilepsy, people that, siblings have epilepsy. It was really just great to see everybody's lived experience and how it was also similar, but also, so unique at the same time. And it was really just an awesome experience. The networking was phenomenal, getting to just talk with people. We now all follow each other on LinkedIn and, getting together and just really trying to push advocacy forward in the research field together as a group, and where our voices can be heard. I already am getting emails of opportunities that, to have our voices be heard in the epilepsy field, with especially where I said I'm just north of Boston. We have tons of medical happening here, and just, one of the other advocates is from the area, and she emailed me yesterday and was like, hey, I might have this opportunity. You interested? I was like, yep, let me know. Like, what do you want me to do? What do you need from me? And it's just really great to be able to be around those like-minded people, and, going forward, having these opportunities with the Epilepsy Foundation to have our voices heard, where, because we're now epilepsy ambassadors, we'll be doing, I think they said it's going to be quarterly calls, but they're still kind of figuring out, since we're the first cohort, what works and what doesn't. And they're going to keep forwarding advocacy opportunities, and it's just really exciting to see where this will go.
Yeah. And as we know, there is no shortage of opportunity. And when we talk about institutions like the FDA, and just, it's so great to see more energy behind this. And there's a lot of things that are shifting. I mean, you've been in calls, I've been in calls of updates that seem to change hourly, especially with epilepsy research. And, epilepsy is the largest impact area, subsequent diagnosis in our community. So, HIE is kind of this mid catalyst, like things cause HIE. HIE is the unifier. And then outside of that, are different subsequent diagnoses. So epilepsy is the biggest one for us, and multiple types of epilepsy and seizure disorders, infantile spasms, ESES, whatever it's called now. There's so many different things. And so, we've been learning as an organization about the process over the past few years in particular as things go through. So, like one of our partners And this is, I think we have a lot more information. You could talk about this for hours about the process because it is so complex. It's really hard to distill that down, I think, to a key takeaway. So Deanna, good luck with these. But it is really tricky because there's so much complexity to it, right? As you learned and had a chance to sit down, and listen to people that work for the agencies. The FDA first and foremost is focused on safety. So, the hurdles that people have to go through to move forward something, it often starts in academia. It starts with academic researchers. They might have a new discovery, and then they'll partner with, a pharmaceutical company or a med device, group or whatever from that business side, get it into the hands of patients and families. And it is a Herculean process. I mean, like one of our partners who started in academia, their discovery is in a phase 2 trial that we partner on, Rialta, and it's a new peptide discovery. It's a new compound. And so, they've been at this now. They first discovered, I think it was like 15 years ago. It's quite the process. And looking to see, how the steps to get a drug in particular into a clinical trial. You have to have really good preclinical data in animals, non-humans. And in HIE, we've talked about this a little bit, where there's just like there's a ton of the preclinical models, and then you have to have it show safety data in healthy adults. Before you ever get into, when we talk about babies and kids, I mean, the hurdles to get there are even greater. And so it's definitely something that we know families are hesitant always, when there's a new drug or something that, to consider what's the safety data, and these are really important questions to ask. And this is why we, thought this role for our families was so critically important for you to be engaged and step up into. And we're so grateful that you have, because there are so many questions, and it's overwhelming. Everyone wants the best for their kids. We all need more research to move forward for this population. HIE impacts in so many different ways, and you have just these layers upon layers of complexity that goes into this, how families are feeling, where families are at, where the kids are, where the babies are. It's not a shortage for sure. And so I'm just so grateful that you are a part of our team, that you are continuing to grow into your own shoes in this, and doing really amazing national advocacy work and international advocacy work. And really, harnessing your journey for the greater good, and an inspiration, I think, for so many when we talk about embodying hope in action. And so I think as we come to the next part of this, what are, from your perspective, some steps that families can take to raise awareness, make their voices heard, get involved in the advocacy space? I'd love to hear your thoughts on this.
So as we all, if anyone knows me, I call myself the walking, talking billboard, because I'm always, if you know me, you have heard of HIE and you know about Hope for HIE, because I am always wearing a t-shirt, a sweatshirt, talking about it. The first step of advocacy is awareness. First step is getting the words out there, getting, the resources known. So first step is just talk about it, be about it, walk the life. We all walk it every day. Why not let people know about it? Everybody's advocacy journey looks different. Some people have the time and the ability to go walking on Capitol Hill. Others, it's just sending your state reps an email or Congress an email. It's, or it's even just, like I said, talking, being supportive, talking to your child's medical team about the resources available, like Hope for HIE. It's, the awareness and the advocacy with that. It's, you tell your child's team, then they can pass that along to other families that come after. The child's team might not know about Hope for HIE, or, the CP network, or, you know, all these other different resources that are out there. So just bringing it to light and making sure that people who are in the right places know is a huge part of advocacy. You know, and then as your journey goes on, you kind of figure out your niche, if that's, you know, whether you want to be the one walking on Capitol Hill or out there at the protests, or are we going to just, you know, do our own thing and figure out what advocacy looks like for us. As we know, I've kind of started to grow in my own shoes and get on the larger advocacy scale, but definitely in those early years, I was a lot of just making sure people know about the resources, making sure people know that we're here, that they're not alone, that there's people that have walked this walk before and they're okay. Life might look different. Life might not look exactly what you thought it was going to look like, but we're all okay in our own way. And that's really the heart of advocacy, is the connection, resource, and awareness. And then you can kind of branch out and, like I said, kind of advocate how you feel, whether it's on a micro, meso level, or you're storming the Capitol. It's, you know, it's really just
won't storm the Capitol.
You know what
Don't get arrested.
You know what I mean? Like walking on Capitol Hill, it's really, which, you know, it was great to see when I was in DC a couple weeks ago, being able to be around all the advocates and seeing all the different like organizations that were out there. You know, the Epilepsy Foundation, we were not the only one. There was, you know, a Cancer Foundation that was out there. There was actually a couple different church foundations out there. It's, you know, everybody was surrounding in our country's nation, you know, talking and walking the walk about what we all cared about. And that was really great to see about the heart of advocacy.
Yeah. And, you know, there's so many rabbit holes that anyone can go down. Whatever you're passionate about, there's something to be getting involved with at the local level, at the regional and state, province level, wherever you are in the world, nationally and internationally. So we're going to continue to share out those opportunities. We are building and developing, with the goal to launch it by the end of the month, an advocacy hub of ways to get involved. We've already shared, you know, the key takeaways from last week's Q&A with David Ford, who was at his state legislature yesterday, Pennsylvania. He worked with them to designate HIE Awareness Month in the legislature. So he moved that forward and tries to do that every year for his state. The goal for 2026 will be to see how we can do more of that in the US and beyond, and get recognition. And that awareness does go a long way. Elevating those common needs. Hey, maybe it's a causation. Maybe you are, you know, there's a parent that I know in Texas who got involved in trying to improve midwifery standards of care. And she and several other parents went to their state legislature to try to introduce bills and things like that, and ask for better standards. So there's all sorts of ways, whatever you're passionate about, there's ways to get involved. HIE, again, is so broad. It impacts people in so many different ways, and your own personal experience and your own, where you sit geographically, is going to, determine a lot of what you're extra passionate about. But there's no shortage of ways to get involved. There's no shortage of work to be done. Sometimes it can feel overwhelming, but it can be as simple as sending an email. It can be as simple as making a phone call, showing up to a city council or a school board meeting and saying, hey, my child needs this, and there's other kids in the area that need this particular thing. How can we work together to improve this? And what solutions can we come up with together? And when we have that solution-based thinking, that takes the armchair advocacy of I'm angry about this to action, right? And to make this real change. Again, countless ways that people are doing it. You are one of them. It's so great to see. You are also going to be at an upcoming conference. So do you want to talk a little bit about that too?
Yeah, this conference is like extra special to my heart. So it is called the Early Connections Conference. It is hosted at the Perkins School for the Blind in Watertown, Massachusetts. Perkins has been involved in our life since Rob was 6 months old. He got a cortical vision impairment diagnosis, which is a want to say fairly common secondary diagnosis with the HIE community, especially those who are on the more complex end of things. But so we got involved when he got that diagnosis. We went with their infant toddler program. We had a teacher of the visually impaired through early intervention that was contracted through Perkins. And this conference is specifically for mainly like ages, I would say birth to age about 8, and for just resources, local community resources for children with visual impairments in the Massachusetts community. But there's also going to be, like us, national and international booths that will be there. So I will have a booth set up there. So if anybody is going to be there, please stop by and say hello. It's going to be a great time. I used to attend this conference all the time when Rob was younger. I remember it was held in their little auditorium, and now it is held on 2 different buildings on campus. So it will be really great to be there and just be around the community, and be able to, maybe touch base with people who haven't heard of us, or, their child might not have an HIE diagnosis, but they're going to see the booth, and then, maybe a year or 2 down the line, they'll meet someone and they'll be like, oh, I remember when I saw that booth at this conference I was at. Have you ever heard of them? Again, just spreading the word and being able to be around people that, that are part of our community or that help our community. Because there's a lot of TVIs, a lot of different like ophthalmologists, doctors all attend this conference as well.
Yeah, there's so many ways to be involved. And this reminds me of last month, or the end of February. I guess it's like time is flying. Tina Santos, who is our HIE ambassador in Seattle at Seattle Children's, also had a booth at Rare Disease Day. And sometimes, and that's always, again, I feel like we could talk down so many rabbit holes. Is HIE rare? Like it depends on who you ask. And like certainly there's things that HIE rare disease that can lead to infantile spasms is like the top of my mind, or LGS, things like that in the epilepsy realm. But you, Tina, these opportunities, when they come up, we take them on and we provide resources, we provide tablecloths and pamphlets and all the things. So anyone that is interested and knows of something in your own community that you want to get involved with. We have our Hustle for Hope events that are in person over the next 6 weeks. We have a lot of different community members that are getting engaged. I know mine that I'm hosting in Michigan. We have 3 different therapy centers that have committed to have a presence, in addition to having participation from the local the local hospitals and health systems and things like that. So there's just a lot of things that are really accelerating. There's momentum building. Definitely reach out if you have an idea of a presence that you think we should be at, that you would be interested in doing. We are continuing as we have presence at different medical conferences to try to get people involved locally. So definitely our next one that we'll be looking for is in October with the Child Neurology Society meeting. And so, we try to have a presence and a booth at many of these places and connect with different people, whether it's, at medical conferences, connecting with the medical community and letting people know, or community-based conferences, which I think are really impactful, like you're attending, like Tina attended. It's all really important work, and gets, again, the word out and people connected, which builds community, which is the goal, to take action. So as we are kind of wrapping up here, we ask everyone at the end of recommended resources. What would be some of yours to recommend to our community?
So for me in the beginning, especially, I really utilized our early intervention or early steps. How, everyone kind of calls it something different, but they were really a key to finding things in our community specifically that would help us, being able to connect to those resources and just connect to other families in the area that living similar lives. So they would be my number one, especially in the beginning. And then as our journey's gone on, we have utilized, those specific topic-based Facebook groups. Sometimes those are a good place to start looking for information. Not always, as we know, even with the Hope for AJ groups, we always take everything with a grain of salt, but, take looking for specific information in like search bars. And like, I know when my son got his G-tube specifically, there was a specific G-tube group that I found really helpful. And then, as our journey's gone on, the Courageous Parent Network has some phenomenal resources and videos and information about different stages of journeys and different medical complexities. Our local ARC was really helpful. They have provided a lot of different resources and connected us with like our home nursing, and everybody's ARC is a little different across the country, but it's always a good starting point. The CP network has had a fabulous amount of videos that have been helpful from different medical providers. And I think that's, all the ones off the top of my head, at least. I feel like there's so many out there. But those are always like my go-to starting points. Obviously, besides the Hope for HIE groups, those are always my really go-to starting points. But I usually get some information from there and then use that to kind of help my search engine go and find the other community resources out there.
Awesome. And so my last question for you is what, and I think we had talked a little bit about this earlier, but, with this evolution of the organization, of you, of HIE in general, what are the things that you're most hopeful for moving forward in growing? It could be peer mentorship. It could be anything.
Well, being able to see this organization just grow from the beginning is phenomenal to see. When we joined, there was only about 5,000 people in the Facebook group, and now we're pushing over 10, which is, obviously we don't want people to experience an HIE incident, but it's incredible to see that they're getting connected to our resources. It is incredible to see that doctors are referring people to our resources. When Rob was born, it was like okay, this is what happened, wait and see, and really nothing was given to us. So when I hear families being connected to us through their neurologist or through the NICU, or they received our goodie bags, it really just that really just hit the feels for me, because it's really just being able to see people get connected, seeing the peer mentorship program going from the first cohort of a handful of us to now over 18 trained peer support mentors, to the point where we needed my position because it was too much for someone to do by themselves, between, all the advocacy work our social worker does and then the, admin portion behind it. It's a lot, and it's a really incredible and mind-blowing to see it happen. And I can only imagine, we've grown so much over even the last 5 years. It's just exploded. And so I can only imagine in 5 years from now what it will look like. And especially, like you said, the explosion of the research field with HIE, for the longest time, even 8 years ago, there wasn't a ton of research being done. It was, okay, you get cold and this is about it. It's, any of the research studies we were a part of were for other things like epilepsy, or they were more observational studies, or, new medical equipment, like new MRI type machine. So it's really incredible to see, the advocacy has pushed these research to be, whether it's in the NICU still, or, post-birth or pediatric acquired, and just seeing that people are listening, people are paying attention. They hear the need that, we have this community that has unmet needs, and they're listening and trying to meet them. And it's really mind-blowing to see. You can imagine in 5 years from now, hopefully we'll have, 30 peer mentors, and maybe I'll even need some help.
Absolutely. Oh, Q, I see you. Thank you for the comment. Incredible. So grateful what Hope for HIE has done for me and my family. It is, it's a labor of love and passion that we share. There's countless people, many hands and hearts that make this all happen behind the scenes. and it's really wonderful. We're really trying this week in particular. Deanna's done such a great job to encourage all of the staff members in particular to have like an overview video of the work that they do for the organization. And then our volunteers will be coming up next with that, our board, our medical advisory board. And yeah, it's really, I obviously very much relate, remembering back to those early days now, almost 13 years ago. Max's birthday is also in April. So, Rob and Max are our HIE Awareness Month babies. And thinking through how, now there's so many families that we see it every day, get connected like day 1, day 3, day 5. And they're like, it's just unreal how that change has happened. And it's happened through so many people's efforts. And we have so much more to go. It's like, I feel like, and I say this often, our organization feels different every 6 months. Like
Absolutely.
There's so much going on, and trying to meet the needs, of the community in the best way that we can, with what we have. And, through the support of so many people and the baton passing over the years, it's just really incredible that we get to be at this point. And so I'm so thrilled. I love hearing when I go to conferences, like people will say, Hope for HIE is everywhere. I'm like, yes, that is intentional. That is the strategy. Yes.
Yep. That was at the Epilepsy Conference
compliment you could ever give the organization is saying that we are everywhere. Because it's a lot of work to do that.
That's how I connected with the Rare Epilepsy Network at the walk. She saw my sweatshirt and tapped me on my shoulder and was like, "Hey, you're with Hope for HIE," and I was like, "Yeah, hey."
Yeah, it really is an amazing landscape. We have just the most amazing community. So generous with their time, their talents, their everything. And it's a great, I'm so glad that we could share your journey today, and let everyone know the great work that you've been doing. And so grateful always for that. And we'll continue. And we always love to hear feedback about what people want to see more of, from the organization and any of the buckets that we cover, which, when we first started, we focused on awareness, education, and support. And we've added advocacy and research to those. So we have kind of our 5 pillars that we call it now. So if you have ideas, you have some things that you want to contribute to, please reach out. We're not always great about being able to place people with specific things right away, but try really hard to engage and make sure that, if you have the time and you have the passion to do it, we want to support you in doing it. So thank you again, Allison, for everything that you contribute. Thank you, everyone who's been tuning in live and who will tune in for the replay. And Deanna behind the scenes makes all of these things so seamless for us. So thank you to the full team for everything. So Allison, it's been wonderful. And thank you again for everything.
Thank you again for having me. I'm so excited to see where this all goes.
All right. Well, everyone, we will talk to you soon, like this afternoon, because we have a Q&A at 2:00 p.m. Eastern time with Dr. Monica Arroyo, who is a pediatric neurologist at Joe DiMaggio Children's, and she'll be talking about the various causes of HIE. So look forward to that one next. All right. Take care, everyone.